We were keen to develop this project because the NHS is obviously going through quite a financially tough time at the moment, and as part of all of the reforms that are underway, we need to make sure that all of the workforce, the vitally important clinicians, but equally the workforce who make everything in the NHS able to run effectively and efficiently, are all borne in mind when we plan how we're going to change systems so that we can produce care that's wrapped around patients more effectively.
The workforce that we've been talking about today, these staff love their jobs, they have an occupation with their identity, they're proud of it, but so often they get ignored, and worse than that, even reviled as back office staff, non-frontline, non-clinical. So that was my motivation for wanting to be involved.
Non-clinical staff are incredibly important to the NHS, that we need to value them, we need to make them feel valued, and that if we don't do that, it will be incredibly difficult to see how the NHS will progress how it needs to over the next 5 years.
What I hope the interim report will do is identify that the groups of staff we've been talking about aren't one amorphous lump of non-clinical staff. These are groups of staff with specific occupations, with specialist skills that the NHS needs to continue to retain, needs to motivate and needs to value.
I think one of the things we find is that when you are trying to change the health system, when you're trying to develop people in their roles, one is the most successful instances are when people have really thought about their workforce. And by that we mean the whole of the workforce, okay? The other aspect is, and where we see most success in new roles coming through, is when people have clarity about the role that they're supposed to be undertaking. And that clarity is really important for them to know whether they're doing their jobs well, but it's also very important for their managers, both their immediate line managers and indeed for people further up in the organisations as well.
I think a key message is to be able to describe the value and benefit of having people doing these kinds of jobs in healthcare. So can you describe this part of the workforce in terms beyond cost? What is the value that they provide, not just to patients and public, but also to other staff, whether they're clinicians, other people helping provide services?
I think one of the key things is we want to look at is how can we change the culture within the NHS to ensure that when we get to the ability to have to drive out efficiencies, that we drive the right efficiencies out, and we make sure that these are driven by the right needs for the patients rather than just a financial need.
The opportunities that's developing at the moment is the establishment of the STPs, the 44 systems, and it seems to me that that's an opportunity to think differently about how support staff are organised, how their contribution to the NHS is organised, and to make sure that we do that better in the future than we've done in the past.
The changes that are underway in the NHS are about driving a more networked performance and not just acting within organisational silos. So HSJ is very keen to ensure that the important non-clinical staff get the understanding and the consideration and the recognition and the training and development to help the NHS on a very, very challenging journey in tough economic times.